Hey, Dr. Greg Thompson with the Southeastern Institute of Restorative Medicine, and hopefully your functional medicine doc to help you with problems that maybe traditional medicine isn't doing its job. What do I mean by that? Well, let's start with something simple. Someone asked me a question about a follow-up to what I mentioned on genetics and nutrition. So let's start with the maybe single most common genetic mutation that a huge part of the population can run into. 40% of the population. Remember that genetics are the basic building blocks of what runs our cellular metabolism, construction. It's what tells our body how to process foods, how to process protein, carbohydrates, fats, how to build cells, how to take from here and put it to here and put it here and make it a hormone, or to make some cholesterol so I can patch the artery that's inflamed. Genetics sort of are the underlying blueprint for how everything is run. And knowing that can be extremely powerful. So we're going to go ahead and take the case of the day. So the case of the day is my hairdresser. She's wonderful. You'll love her. We were having a conversation, and it came up while she was cutting my hair that she had difficulty getting pregnant. And she required some in vitro fertilization. And this is not a HIPAA violation, because if you know her, she gave me permission to talk about it. So doing what I do, just someone says something, it's I would love to call it ADD, but it's something that when you say something, if there's something that I might have an idea about, I'm going to bring it up. So she brought it up first, so I brought it up second. Trouble with getting pregnant. So the easy thing that you think of in anybody who's having issues with anything that I'm about to mention should trigger the thought in your head. So in this case, the first thing she said was pregnancy. So I said, well, do you have any problems with anxiety? Yes, all the time. Okay, so anytime someone thinks anxiety, in the back of your head, 40% of the population has this mutation, so maybe this is it. Okay, so any problems with ADD? Yep, I take ADD medication. I'm scattered, foggy-headed. I can't quite get past that brain fog. And with the anxiety, there can be sometimes mood swings. In the past, in and out of some slight depression, never required medication for it, but it was there off and on. And so then, of course, the triple threat was, do you have any difficulty, getting to sleep at night? Oh my God, I absolutely, my mind races. It's terrible. I've never slept well in my life. Okay, so let's take the mthfr gene, what we lovingly call the mother effer gene. Methylene tetrahydrofolate reductase is the gene. We get one from our dad, one from our mom, and they come together. If we have a mutation, what they call a single nucleotide polymorphism, a SNP, then it can be one bad mutation or two bad mutations, and then it's even worse. So you can have one and have a little bit of symptom, you can have two and have a big set of symptoms. And so in this case, I thought, well, let's ask a question. So when they were having, when you're having difficulty getting pregnant, did they do a genetic test? Because most people I run into haven't had a genetic test. They're only about $300 or $400. You do them once in your entire life, and it can literally tell you which medications you should take, which medications you should not take, which vitamins you should take, which vitamins you don't need to take, what things you can do, like can I do caffeine, or you should never do caffeine. A simple test can show all that. But you can also find out by just talking to the person. So we've talked to this person, and now, yes, they did the test, and yes, I have the mthfr gene. Great. So you're on methylated B complex. Why do I ask that? Because the mthfr gene is responsible for converting folate or folic acid, which I'll talk about in just a second, into the methylated version. The methylated B complex is the active form of B9 folate to allow us to detoxify, to create DNA synthesis, so the cellular construction of things like blood cells and nerve function. It can come off as anxiety, mood swings, brain fog, a lot of different things. And yes, it certainly can show up in young kids with ADD symptoms. And what do they live on? They live on cereal. They live on Fruit Loops and Ding Dongs and Yoo-Hoos, and they live on enriched or fortified grains. Folic acid, a synthetic, not found in nature, B vitamin, is sprayed on all our grains to allow nutrition to enter the population, much like fluoride is put in our water to fix those people who don't brush their teeth enough, can't absorb fluoride, and so we try and use it to protect the entire population when the entire population doesn't need it. Well, the same is true for folic acid. But the worst thing a downside of folic acid, because I'm not saying it's a toxin, but anytime you have something that builds up that you can't convert, could theoretically that be a problem? Yes, in two ways. One, it could be what's building up is a problem. It's also what you're not converting it into that allows your nerves to function the way they're supposed to, that allows you to have hormone regulation, that allows you to get rid of inflammation. One of the more common things that someone who's got a double dose of the mthfr gene is they can't break down homocysteine, which is responsible for blood pressure issues and cardiac and artery disease. Well, if I'm not taking the right vitamin to prevent that, then yes, I'm more likely to have high blood pressure and heart disease. But if I take that, am I then therefore less likely to have blood pressure problems? Yes. Am I less likely to have heart problems? Yes. Am I less likely to have sleep, anxiety, ADD issues, anemia issues? The answer is yes. All because in this case, you now know that you have that. Well, say I don't know if I have it. I don't want to. Then just take a methylated B complex. Don't do folic acid. Don't do enriched or fortified grains. Take a methylated B vitamin. So, for instance, well, Greg, what do I do about my kid? Okay, put them on a methylated B complex. It'll say a methylated B complex. Make sure you're getting, I would suggest somewhere between the 300 to 500% of the daily recommendations. I always say in adults, at least 1,000%. They're water soluble. They're not going to cause a toxic reaction, especially in just a few weeks. Put them on that. Get them off sugar. Oh my God, get them off cereal. Stop that. Get them off sugar. Do some whole foods. Just 3 weeks. Whole foods, nothing from cellophane. If you have to pop open, the wax bag to get to the cereal and it's fortified or enriched, it's probably not great nutrition. ADD is easier to help than you think. But I'm just saying, give this 3 weeks. Give them a methylated B complex. In this case, my hairdresser, we put her on a methylated B complex. It's been not quite 3 weeks. She's sleeping better than she says in her entire life. She's clearer. And she's trying to cut down on caffeine. She hasn't stopped her ADD medication yet, but she's clearly saying, I'm still way, way better. I'm just sort of, nervous that if I do that, give it another couple of weeks. If you're continuing to improve, then at some point, talk to your doctor about how to get off that medication. Sleep issues. The other gene that's real common is the COMT, COMT gene, which makes it difficult to break down dopamine and adrenaline. So just imagine this. You're excited, you watch a movie, you get a little revved up, you're thinking about something, you get a little anxious, and then you lay down and try and go to sleep and your brain keeps running. Well, that's just me. That's my genetics. Yeah, I know. That's this whole conversation. Because in this case, if you've got the COMT gene, either the homozygous or both bad genes, or the heterozygous one bad gene for it, and you're not breaking down adrenaline, then you're going to lay there and that adrenaline's just going to keep your brain running. The normal is you lay down, you go to sleep, your adrenaline gets broken down, your brain calms down, you go to sleep. I can't get to sleep. And you're hypersensitive to caffeine because of this COMT gene. So you can't break down adrenaline. The adrenaline stays around twice as long because of the caffeine, and you can't break it down. You want to know why you've got a sleep disorder? What do I do? Well, you take a little bit of magnesium. I'm going to say 300 milligrams in an adult. Talk to your pediatrician or talk to us if you're really interested in what doses or levels we should have for kids. Take a little magnesium maleate, glycinate. Try not to do the citrate. It's more likely to give you some diarrhea issues. The carbonate, it's not as well absorbed as the maleate, glycinate. But in any case, if you want to get the one with 7 different magnesiums, do that. But that is going to help you with the B complex to override your body's inability to methylate and break down, in this case, the adrenaline. It's just genetics and it's just nutrition. In med school, we're taught all this biochemistry, and then they say, you'll never use it. Well, now I use it I use it every day. And then, genetics, well, it's just, the occasional person's going to show up with a genetic thing, or you're occasionally going to have the funny looking kid who's like, no one's been, it's a genetic issue. Okay, that's great. But I'm seeing genetic issues in almost everyone that walks through the door to some degree or another. That diet, nutrition, and stress management, breathing correctly, doing things that are really, really simple, avoiding certain foods, make all the difference in the world. My hairdresser, sleeping better, focused better, and all we did was just give her a methylated B complex. for something they should have told her when she was trying to get pregnant. Could it have avoided the pregnancy issues? The answer is yes, because she's got the mthfr gene. Could it have avoided medication for anxiety? Could it have avoided medication for ADD? Could it have avoided sleep issues? Yes, 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 and yes. So, long-winded way to say, stick with nutrition. Go to your favorite ChatGPT or to Grok on X and start looking up this stuff. Say, just plug in a bunch of symptoms and say, okay, I've got this, this, and this. What are the 15 or, or the 10 or the 5 or the 3 most common genetic mutations, and what nutritionally can I do? Now, I'm not saying junk your medications. Don't junk your medications. This all has to be done. I mean, simple nutritional things like taking a B complex, it's a no-brainer. But don't just start changing your entire regimen without the help of your doc, without the help of someone like us. And recognize that, detoxification, meaning like eating spinach and eating avocados and getting your greens, could help with mood swings and foggy brain and high blood pressure and hormonal issues and sleep issues from just simple
things.
Long-winded. I can get that way because I'm passionate about this. I'm passionate about your health. I'm passionate about vitality. And we go back to my phrase. This is the phrase that we sort of live our practice by. Are you living to die? Are you getting by day, just trying to manage? Or are you dying to live? Are you looking to improve? Are you looking to be more healthy? Are you looking to lead a life with more energy and not just one day at a time heading downhill? I want to be heading one day at a time uphill where I feel better and better and better. Greg Thompson, signing out. Live life to its fullest, and I'll be back with more sorts of stuff. Just ask us questions. Feel free to call us or find us on Facebook or find us on YouTube. We're going to be on Instagram. We're going to be on TikTok. We're going to be all over the place because it's time that I help you guys do the simple things to get you feeling better. Thanks.